I feel like everybody with PCOS, they get told birth control, 1,200 calorie, low carb diet, boom, go exercise. That's your
Yeah,
treatment.
they're told to like restrict their diet crazy.
And they end up with disordered eating. So
Yeah.
believe it or not, like a lot of the people I work with, they have some sort of hormonal issue or some sort of digestive issue. And then they have disordered eating on top of that because all of the treatment plans told them to restrict their food, avoid this food. You can't have this food because it's high FODMAP. You got to be on a low FODMAP diet, like all these things. And it's like you're creating a whole nother host of health issues by creating the disordered eating. So it's like, you don't have to be super low carb in order to manage PCOS. I've seen it. I've seen a girl on 300 grams of carbs with PCOS and she lost weight. Not that it's about losing weight, but it's like, it doesn't need to be super low carb. Amazing. Okay. So today we're going to be diving into birth control, all things birth control, the different forms of birth control, our personal experiences with birth control, and also diving into just general pros and cons and some post-birth control protocols that we utilize with our clients when they're making the decision to come off. So, Kate, if you want to kind of take it away with some stats about BC, we'll start there.
Yeah. So on birth control, this is going to have a direct correlation to the gut, which is crazy because everything relates to the gut. So in 2008, there was a study with 50% increased risk of developing IBD, which is irritable bowel disease, which I know a ton of people suffer from,
Yeah.
me included. So that's crazy. And then 24% develop Crohn's disease, and 30% have a higher risk of ulcerative colitis, which just thinking like this one little pill or this one little shot can cause this much damage to the gut is like insane to me.
Yeah. I feel like most people that come to me, at least, they're usually having some sort of coinciding digestive issue. Like that's kind of the reason they reach out. They don't really reach out because of the birth control, but they're having digestive issues or like weight loss resistance alongside that. And then we're like, oh, how long have you been on birth control? What form of birth control? And it's like kind of starting to unpack that and then realizing like I usually don't default to blaming the birth control. I rarely ever do that, but in some cases, the birth control is the problem. It's the sole issue.
Hmm.
So to hear those stats is kind of jarring. Like to see how impactful the birth control is on the digestive system, and the issues you can develop alongside with it is just a lot to deal with as a person. Um,
Absolutely.
yeah.
Yeah. So it also causes leaky gut, which is awful. And it's modifying the intestinal permeability of the gut, which is just allowing more things to come in, allowing more microbes that are not good, like all this bacteria to infiltrate the gut and cause all of these problems.
Yeah.
I
And
think that like this alone, just these stats alone, should drive you away from all these things.
I think it definitely should open your eyes as an educated consumer. And I
Mhm.
think when it comes to leaky gut, what people don't understand is like, yes, there's increased permeability in the actual gut, but that also leads to an increase in systemic inflammation everywhere because over time, that bacteria translocates into the bloodstream. And so all of these undigested food particles, things of that nature, they're getting into places where they should not be. And when things are getting to places they shouldn't be, they cause a lot of problems. And when we have systemic inflammation, that's when we start seeing things like autoimmune disease develop. We see really intensive signs and symptoms of GI. So you might have had no GI issues. Now you might be having a ton of issues. That's where we can also see SIBO begin to grow and accumulate. in the small intestine when things are translocating to places they shouldn't be. We also will see that with systemic inflammation, people have a lot of difficulty focusing. So, like brain fog and not being able to concentrate. That's one of the, I'd say, largest complaints that I see with somebody that has like a case of leaky gut is the brain fog is so intense. And that goes to show you, like, that's a very progressive case. Like, it's gone on for a long time, but it's more than just the gut. It gets everywhere. It systemically inflames you. So it can lead to this systematic problem over time. And I remember in school, Kate, I don't know if you guys touched on this a lot at Merrimack, maybe like in advanced human nutrition, maybe a little bit more so about leaky gut. But I feel like I've come across a lot of different ideologies about leaky gut, meaning some practitioners and professionals believe that it's a thing, other people don't. And I feel like when I was at Simmons, they actually tried to promote that leaky gut like wasn't a proven thing. And like I understand like some of the evidence-based literature might not be 100% there with like RCTs and like having a Cochrane review, available to pick from. But I think there's definitely something to be said that there is some sort of leaky gut phenomena that can happen, and it is taking place, and we're seeing more autoimmune conditions more than ever before, and we're seeing more gut issues than ever before.
Yeah.
Kate,
It's
did
like
you have any like education on that in school with like advanced human nutrition and like
yeah,
any?
I think we touched upon it, but I don't believe that my professor was very like big on digestive issues in general. So
Yeah.
it was much more like what minerals you should be ingesting and all these things and
Wow.
like everything that can like help these things, but it was never going in depth of what the problem actually was. It was never
Yeah.
like, getting to the root problem,
Yeah.
which I thankfully did more research on, but because I
Absolutely.
was interested in like what was going on in the body in order for these minerals and all these supplements to be able to like help that.
Yeah.
But
Hmm. Absolutely. Yeah. So I feel like it's kind of like a toss up, like as to who you talk to. Some people
it's
believe it's a thing.
yeah, exactly. It really depends on like who was your professor or like where did you get this information from? Because it's very much a what that person is interested in, that's what they're going to teach you, which is
Yeah. Their
human
bias comes out a
nature. Yeah.
lot. I found that a lot, especially in grad school. Like there was a lot of bias, and like we all have it. Like it's hard to kind of fight it. Like I know I have bias about certain things. And I try to be really good about like not only leaning into what I'm biased about, and learn from the other perspective, like specifically with things like Ozempic, right? But like
Exactly. Yeah.
I feel like my professors, we did like a whole ass like literature review. Like people got assigned different groups, and one group had leaky gut. And I remember sitting there and I'm like, but have you guys looked into like the most recent literature? Are you just kind of referring back to like what you learned 20 years ago when you were an RD? And like there
Yeah.
was,
When you learned it in 1995. So
respectfully, like, you know what I mean? And like,
yeah.
I think you need to open up your mind to it. And yeah, so I think that leaky gut is definitely something that we're seeing more and more of. And we're probably going to learn more and more about it and the long-term effects that it may or may not have. But that's also like a part of the work that we do here at TM, like Kate and I, some of the other coaches. We work on trying to heal the gut in terms of the gut dysbiosis, trying to make sure that we can strengthen that gut permeability so that that integrity is in a better spot. So that way these like tight junctions, are tight and where they should be rather than like apart, and allowing these big particles to kind of flow through. So I love using things like glutamine here. I think that can be really beneficial. I know Justin's a big fan of bone broth. I'm still like on the fence about it because the evidence behind it is like still up and coming, but that's where I can also explore as a dietitian.
Yeah.
Um, I also love using things like aloe vera for anti-inflammatory, high dose of omega-3s. That's great in terms of bringing the inflammation down. Um, but all things aside from that, just making sure that you're consuming a diet that works with your gut too. So not too high fiber, but enough fiber. Sometimes I bring in, if there's a lot of like gaseous producing bacteria, something like New Ethics Gut Defender or Biofilm Resolve, when it comes to addressing some of those imbalances, if you will, with the good and bad bacteria. But I think let's dive into the different forms of birth control because there are so many. And I feel like this comes up in conversation a ton for me with my clients. Like, should I be on birth control? If I am going to be on birth control, which is the best birth control for me? And like, I'm going to say this, like, I am a dietitian. I am not an OBGYN, but I have done a lot of research on birth control as it pertains to nutrition and how it can impact metabolism and weight loss and weight regain in the thyroid. So I feel like my most common recommended for people that are looking to go on birth control and they want the most minimal side effects would actually be the copper IUD. So the copper IUD is going to work through basically creating a spermicide in the uterus. So it kind of kills off sperm. And this is because there's such a high amount of copper, it's like toxic to that area of the uterus. And it can disrupt that motility of the sperm, and therefore you can't get pregnant because it can't fertilize. It also, again, where it's pretty toxic in that one area of the uterus, it causes inflammation. So that'll also increase the presence of white blood cells and enzymes and other things. And this environment is really detrimental to the sperm. So it also kills off the sperm through that way. And there is a physical barrier in terms of the actual IUD implantation itself. And that will reduce the likelihood of pregnancy as well. So one thing I wanted to mention about the copper IUD is because it's such a high amount of copper in your body, it can actually cause you to become zinc deficient because copper and zinc, they compete for absorption. They use the same transporter there. Also can start messing with magnesium. So when you have a copper IUD, I do recommend supplementing with some form of zinc. Zinc picolinate is a pretty good one. You can also just take a multivitamin and just see if that keeps you covered. I will also, in some cases, use a higher dosage of zinc, like up to 50 mgs if I need to. But that's one little just nutritional preference I like to put out there. Kate, anything you want to add about the copper IUD?
Yeah, so I never had an IUD personally, but when I first heard of them, I'm like, oh, that's so like it's scary to me almost because you hear all these horror stories of like inserting, taking out, and replacing, and all these things. So I feel like there's a stigma around it almost, just pertaining like how painful it is, like inserting. But the fact that it doesn't, it's basically like made of copper. It's not um giving you these hormones. It's not giving you progesterone. It's not doing estrogen. It's just strictly copper. And the only thing that you really need to do to keep up with that is supplementing with zinc. Um I think is one of the best choices that you could make
Yeah.
if you're, say, you're very sensitive to hormones. Like if you even have a little change of estrogen or a little change of progestin, and that'll basically fuck you up. Like it's going to.
Talk about,
So
yeah, exactly.
Um, yeah, no, I think out of all of these that we're about to talk about, I think this is probably the best solution for birth control if you are thinking about it, if you're thinking about going on it, or if you want to change whatever you have to something, this would be it.
Agree with you wholeheartedly there. And like, yes, like it's a non-hormonal form of birth control that's extremely, extremely effective. And you can have this IUD placed for up to 10 years, which is great. As somebody who has an IUD, I have the Kylina, and we'll talk a little bit about our personal experiences with birth control, but I have had it inserted, and like it's a pretty painful cramping experience that you experience when you get it. I know that some practitioners give you the option to get like an injection of like almost like it's almost like a pain med basically to help reduce the pain that you
Like
experience.
lidocaine or something.
Yeah, it's something. I know,
Yeah.
well, because a client of mine was gonna go, it's so funny. Like a client of mine was gonna go and get the copper IUD. Like that was gonna be her choice. And she was so nervous about the pain. And I said, ask about the like the pain shot that they can give you. And they didn't do it where she was. I believe she's in Wisconsin, but like I live in Massachusetts and they offered it to me. and I believe I got it. I honestly can't remember. It was so long ago that I got
Yeah.
this thing started. I need to get it out. I'll just be so transparent. This thing has been expired in my body for 2 years. I know it's really bad and people are going to come at me and I don't care. I am working on getting it out. I have been so busy with life that I haven't had a chance to deal with it. And I'm having perfectly fine periods and all that. I know it's dangerous. Don't come for me. But I need to get it out and I'm not planning on getting another one in. So like I'm planning on going like just natural
All
after.
natural.
I'm going all natural after this. But the pain wasn't so bad. Like I would get another IUD if I wanted, but I just feel like I know how to like naturally avoid getting pregnant now. And that's kind of the route I want to go. Because I was on birth control since I was like 15. So like I'm
Same
27.
here. Yeah.
It's just I'm ready to be off. But yeah, so the pain can be a hit or miss, but see if you can get like the pain, the anti-inflammatory injection there. And they'll also tell you to like go pretty high with ibuprofen most places, like 800 mgs a day. The cramping was the worst for me the day after I got it
I
done.
was gonna say, did you hurt after?
So like after I was okay, I actually went to the beach that day and then I actually went to the gym that night. Because I was in
Oh,
contest. I know, right? I was like, fine. Carrie was literally in the car when I got it done. She was like, all right, I gotta get my IUD inserted. Bye. And then we went to the beach.
I
Yeah. And so it wasn't that bad, but the next day I was in a lot of pain. So I would recommend like maybe take the next day off of work. You could probably go in the day of, but like the next day, take it off.
yeah.
If you but cool. So kind of like in the spirit of IUDs, I'll dive into Kylena. So Kylena is the one that I've had. And it has a levonorgestrel. I'm probably butchering that. Levonorgestrel. I can't even say any words. Which is a type of progestin. So I can say progestin. So we all have progesterone in our body, which is a female sex hormone that is pretty much responsible for us getting a period, very important for the placenta creation when you do get pregnant, plays a big role in our fertility health. And when you're supplementing with something like Kylena, which has a synthetic form of progestin, it's going to decrease your natural progesterone production, which is just that natural hormone that your body already makes. So that's how a lot of these birth controls work is you're supplementing with a synthetic form of the hormone. So that communicates to your body that it doesn't need to produce that hormone anymore. The reason this one is a good fit is it doesn't have any form of estrogen in it. So it's basically a synthetic form of progesterone. And because of that, it can be a better option for people who are at increased risk for stroke, heart attack, breast cancer, things of that nature. Um, I really enjoyed my experience with the Kylena. I have really no negatives to say about it. The way that it works is there's a thickening of the cervical mucus. So that's going to make it difficult for the sperm to enter the uterus and like reach an egg. It's going to thin the uterine lining. So that reduces the likelihood of the sperm being able to fertilize and then implant. It's going to inhibit the sperm movement and it'll also suppress ovulation. Now, I will say this, I got a regular menstrual cycle throughout the entire experience of the Kylena IUD, except for when I was in like contest preps or I had a very high stress month, like during my internship, my period got kind of wacky. But I did get a regular period throughout. But some of my clients that are on it, they don't get any sort of a period. They'll get like symptoms. They'll get like bloated, they'll get irritable, they'll have like every symptom in the book, but they never actually bleed. So those are some things to kind of like look out for. I do think that there is more hormonal fluctuation that can happen because it's not an estrogen and a progesterone based birth control. So like it's kind of lesser intense, if that makes sense, in that regard. So when I went on it, it was because I was actually on the pill for a long time and I was getting these wicked bad migraines. And one day I got one where I had aura. So like if you've never had a migraine with aura before, it's really scary. Like you feel like you're having a stroke, like you can't see straight. I was like doing homework and then all of a sudden like the words on the computer were just like so crazy. And I then had like numbness go down the side of my body. I like couldn't really speak normally on one side of my face. So we like called the doctor. We're like, should we go to the ER? Like, we don't know what's
That's
happening.
like terrifying. That
And I
is
was, I think I was 20 years old. I think I was 20 years old at the time. So I was like, no way am I having a stroke right now. Like, that's impossible. I didn't end up going to the doctor, but my PCP had called and was like, we need to get you off birth control. And they were concerned because my family has a history of heart disease and breast cancer and all kinds of things. So they didn't really want me going on it anyways. But after that, they took me off and they were like, you have a couple of options. You can come off the pill and get on some sort of IUD, go on the mini pill, which we'll talk a little bit about, or come off completely. So I chose the Kyleena. And another thing with the Kyleena, you can have it in for 5 years. And it typically is going to be a lesser symptomatic form of birth control, but I've had clients that like hate it. Like they absolutely hate it. They've had nonstop like bleeding since they got it in. Like it felt like they had their period for a month. Like it was like not a good fit for them. So like everybody's experience is a little bit different.
Mhm.
So that's kind of what the Kyleena is. So low dose of levonorgestrel. I hope I'm saying that right. I should probably look that up before I did this podcast. Huh? But yeah, so that's what the Kyleena is.
I'm trying to say it, levonorgestrel.
I'm like, I can't like that's like when you're, I don't know if you've ever like tried to like say the different like bacterias in probiotics.
No, they're like in Latin. I'm like, I can't.
Literally. I remember I had a presentation once and I was like, I'm sorry. I know I'm butchering this. Like, please just know it's a type of bacteria. Um,
You just know this is what it looks like, and this is how I'm saying it. It's up to everyone's interpretation on how
Yeah.
to say
Cool. So like then we'll talk about the marina. So the Marina. I can't
it.
even
Marine.
speak
This
today. I
was
need more coffee. Okay. The Mirena IUD. That's a longer acting reversible contraception. So this is like a good fit for people who haven't given birth yet. So some of the IUDs, like some doctors, depending on basically the size of your uterus, like you can either be a fit for it or not. Like if your uterus is a little too small, then you can't get certain insertions, which I'm sure is probably lousy to go through because you might not know until you're like at the
exactly.
insertion appointment, which
Like, no, you can't do this.
but the Mirena is another form of IUD. So it's going to thicken the cervical mucus like the Kyleena. It's going to thin the uterus lining like the Kyleena. It's going to inhibit the sperm movement and partial suppression of ovulation. And there's long-term protection up to 5 years, similar to the Kyleena. And it's definitely like a high efficacy rate. Most of the time, people are not going to get pregnant with an IUD. But if you do, it can be very dangerous and you can have an ectopic pregnancy. So, something to be mindful of, which means you basically have a pregnancy like outside of the appropriate place of your uterus, which is pretty scary. But this also works with levonorgestrel. So that's going to be kind of the primary hormone that the body is receiving when using this form of birth control. Um, there's also the Skyla, which is another form of IUD. This is effective up to 3 years, and it has a failure rate of less than 1%, so still very effective. You're likely going to experience lighter periods on it, and the effect is less pronounced compared to the Mirena. And it's usually going to be suitable for women without children. Again, just due to like the smaller size of the actual IUD itself, it's a better fit for people who haven't undergone a pregnancy. I believe the copper IUD, they do recommend for a lot of women, like if you've been pregnant, like it's a better fit for that because I think it's a bigger
Bigger.
insertion. But you can still get it. Like you can still get it. I think, of course, if you go to the insertion appointment, it's like a toss up as to how it's going to go for you.
That
But
might be another factor of why sometimes it really hurts a lot.
I bet, yes.
You know what I mean?
I know because everybody's uterus is probably like different size, like
Yeah.
in terms of like I don't know. Because if you've ever seen it, it's almost like a little, like it looks like a T, like a
Yeah.
little like T, and they're so teeny and they just like put it up wherever.
I know.
So
It goes in like a tube and then you go it and then they lets
easy.
go. It's very weird. It's a
It
very
is easy. So yeah, the type of practitioner that you're working with too, like that makes a difference. Like I think I had a really skilled practitioner. She was a nurse practitioner actually that did it for me. And I feel like she did a great job. But I've heard, not to like scare people, but like I've had clients be like, my person couldn't get it in me and it was so painful. And like that's when there's a nightmare. And I'm like just speaking to every woman's nightmare about IUDs and probably scaring everybody away. But like if you have a good practitioner,
but
I think yeah.
yeah, especially if they're like experienced, they've done this so many times. Like it's there could be a bias that comes in there too. Like there you don't know. Like
Yeah.
if I can talk about this later, but when I was talking to my PCP, I
Wow.
was thinking of going on the depot shot. And she was like, I don't know if you're gonna want to do that because blah blah blah. This like it's gonna cause weight gain, and I know you don't want that because you have a history of that and all these things. And like she was looking out for me, but I
Yeah.
think there was also a thing where she just physically didn't want, like she did not think that was gonna be good for me, which I appreciate. But there's always gonna be a bias there.
Yes. Yes, absolutely. And I think that depending on the practitioner that you speak with, like they might persuade you one way or the other. And that's again, like we all have our bias, we all have like an understanding of like what we feel is best. But I think a lot of OBs are kind of moving in the direction of like do an IUD if you can, and like you don't want children for quite
Exactly.
some time. It just seems to be like a lesser symptomatic option for a lot of people if you can get over the whole insertion process. But I also wanted to add one last thing about the Skyla IUD. So it's going to have the same hormonal release as the Kylena, as the Mirena. So it's a progestin hormone, so the levogestinol. So as you can see, they just kind of come in different lengths of time, different strengths, etc. That kind of work depending on the individual person. So we'll kind of dive into like the actual pill itself, and I'll let you.
Yeah. So I take Junel, which
Mhm.
is just it's a blue pack, and then it comes with like 4 weeks. It's 3 weeks of pills and then 1 week of placebo pills. So this one has synthetic form, a synthetic form of estrogen and then a synthetic form of progesterone. So this one, I got put on this when I was 15, I think 14, 15, around there. Just because I was struggling so bad. I was so irregular and I was just begging to like have something, just a schedule. I just needed a schedule and I needed to not like, I was puking, I was throwing up. It was awful.
Okay. Wait, you had really bad periods
I
when
had
you,
wicked bad periods, wicked bad.
that's brutal. And have you, sorry, like have you been off birth control since you were on at 15? Like have you ever had any like stints where you came off?
No,
No.
I've been on it since I was 15.
Okay, so when you come off, we're gonna have some work to do, is basically what you're telling
Gonna
me.
be, yeah. So that's another thing. Like I'm scared to. It's a scary thing because I knew how I felt when I was not on it. Then I'm like, okay, I feel okay on this now. Like I
Yeah.
can just try to stick this out for as long as I can. But that's when I wanted to change it up. I was like, okay, I'm done with this pill because one, it's a chore, basically. It's such a chore to take it. Um, but we can get into that later. This
Yeah.
one, I was put on this one because I told her at 15 I was so smart. I was like, I want a low dose of estrogen, I want a low dose of this and that, whatever. I don't want any type of like super high hormonal like changes. So she put me on this one, which is a good like starter one, I guess, if you're like just starting out, like all these things. So there's 3 rows of the pill, and then the last row is placebo. Mine is might be a generic version. It does not have those placebo pills, but those placebo pills have iron in them to supplement when you're having a period because you're losing blood, so you're losing iron. So that's a good thing to definitely have when you have placebo pills. So how this works is it's very similar to the other ones. It's going to have actually an inhibition of ovulation, which is going to stop ovulating, which some of them before were just partial ovulation.
Yes. Like the Mirena.
Um, it's going to thicken the cervical mucus, which makes it harder for sperm to enter, and then thin the uterine lining, so it's harder for them to like stick.
Mhm.
Um, and on the placebo days, you do still get your period. It's a mock period, but you're still bleeding, so it's kind of that security
Yep.
that you're like you're regular, you're still getting it. It's okay.
Absolutely. And I want to take a minute to talk about why it's a mock period. Like, why isn't it an actual period? So, when you're not ovulating, you aren't menstruating. So, what the week of your sugar pills or the iron pills maybe is more of a withdrawal bleed from not taking the exogenous hormones anymore. So, a lot of women think that they're getting their period more regularly when in reality, they're actually suppressing that process from completely happening. But then when we have those sugar pills or the iron pills, it's a withdrawal bleed. But for a lot of women, it can provide a peace of mind, like Kate said, because you're like, oh, well, I'm not pregnant, I'm bleeding each month, or like whatever it may be. but you're actually not menstruating at all because you need ovulation to happen in order
Exactly.
to. So,
Yeah, I think it's more of a peace of mind. Exactly what you said.
absolutely.
Which was which I needed almost in that time because I was freaking out, like,
Yeah.
wasn't getting my period for a month and a half, and then I was getting it every 2 weeks, and then it was all over the place. So I think for myself, I needed a set schedule because, like, I don't know if my mom wants me to say this, but she was like, "I've always gotten regular periods, blah, 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 like, I'm always on whatever day, it's on Wednesday, that's when I get it, I get in the morning." And I was like, "Oh my god, like, that's so easy." That's like, I need that. That's what because I don't wanna, like, go to school and, like, have to, like, bleed through my pants to figure out I'm having a period.
Literally the worst when you're in like well, if you, depending on when you got your, I got mine when I was 11. I don't know if you remember when you got yours, the
Oh,
first.
I was a late bloomer. I got mine at, like, 14 or so
Did
no,
you really?
I was 13, I think.
Okay. Yeah. So like I hit puberty like mad early. Like I just did. Like I was like 11 years old. I got my period. I remember being like, what is happening? Because it like, not to be gross, it's mostly women that listen, but like it wasn't bright red blood. It was like brownish blood.
Oh,
So what the
I thought
hell?
I shit my pants. I was like,
Yeah,
"What
like
just
I think
happened?"
every girl is like, I think I pooped my pants and I
Yeah,
didn't, like it was so scary. And you get like cramps. So you feel like if you've ever had like, this is so gross, but like diarrhea and like you're like diarrhea cramping, you're like, what is happening to my body right now?
yeah,
It's so weird. Yeah.
exactly.
Yeah. Oh my God.
But the other pill that we have on here is the mini pill, which is no estrogen and it's just progesterone. Um, so I this is a really good one for people that can't take estrogen. So if you have like a history of blood clots, this might be a good thing, like hypertension, smokers over the age of 35, like this is probably a good one if you want to take the pill if you're like not wanting like an injection or IUD and all these things. This one is safe to breastfeed on. So if you had a baby and you want to go back on birth control, you can still breastfeed on this one because it's not inhibiting the milk production whatsoever, which is good. And there's few hormonal side effects with this because you're not taking the estrogen, it's only the progesterone.
Yeah.
And it's basically the same mechanism of the others, thickening of the mucus, the thinning of the lining, and the inhibiting the ovulation. So
Yeah. I feel like all of the birth controls that are mostly progestin based, just again, they seem to be less problematic in terms of the symptoms. So, like, if you do something like a Junofee or like a Yaz that has the estrogen and the progesterone, your symptoms are probably going to be worse. So, something to kind of take away.
yeah, from like all of these things that we're talking about, you see that estrogen is clearly the common denominator in most of these, especially with the pills.
Absolutely.
And I think estrogen is it's depends on each and every person.
Right. Like in some
Very
women,
fluctuating thing.
yes, some women will lean naturally a little bit more estrogen dominant. So, like, if you're somebody that does, and not to um, classify somebody's body type as being more estrogen dominant, but if you have more body fat on your body, you are more estrogen dominant. Your body is going to produce more estrogen because estrogen is produced from our fat cells. So,
Mhm.
if you have more fat cells, you have more estrogen. So, for women that may be living in a larger body, you might feel better with a progestin based birth control as opposed to something that has the estrogen in the progesterone in it. So something to keep in mind. But even women that I know who are like, living in leaner bodies, they feel horrible with the estrogen and the progesterone based birth control. So it's not like a one size fits all, like, okay, if I meet this criteria, I go with this one. Like it's all a very individualized experience for sure.
Absolutely. Yeah. The last one I want to talk about is Depo shot. This one seems so what's what's the word? It's very like, oh wow, that's cool. I want to do that. Like it's very sought after almost. And I know a
Right.
lot of people have it.
Yes, I
You can
agree.
sorry, go ahead.
I was gonna say it's because you like go there and you get a shot and it's like, okay, it's all done. Like I don't have to think about it anymore. And
You
it's like,
go back the next 3 months and get the other shot.
yeah.
And this one is basically the same thing, but after you get that first shot and then you get the second shot, you might have your period during those times, but once you get to like the second or third shot, you're not gonna bleed. You're not gonna have that ovulation. So that I think is something that people like because it's one less thing on their to do list, like one less thing they have to worry about.
Totally.
This one, I know that a lot of people will get it over the years, and you're not supposed to be on this for more than like 2 years.
I have had friends that have gone on it and have had really poor experiences with it, specifically with weight gain on this one.
Mhm.
Even though it's progestin based, it has an effect on the body that I find for some women is going to predispose you to more weight gain. And I think for some people too, they tend to notice more intensive mental health related concerns, so like more depression, more anxiety on this one too. But again, everybody's experience is different.
Yeah, exactly. Yeah. So mechanisms the same. They're mostly the same for all of these, like how they work in the body.
Yeah, very,
It's
very
just
similar.
between the different. If you're taking the pill, if you're taking the depot shot, if you're getting Kyleena, it's like the ovulation kind of fluctuates throughout these, but the mechanism of thickening of the mucus and the thinning of the uterine lining, it's basically working the same way.
Yeah, yeah. And with the different like progestin based birth controls, like there are different forms of the progestin. So like for the depot, like
Yeah,
the medroxyprogesterone acetate is like the type in there, but like with the Kyleena and the Skyla, it's like the levogestinol. So there's different forms of the progestin, and I think that's why also like some women have a worser experience with the depot shot versus the Kyleena because the differences in the synthetic progestins like can affect people differently.
exactly.
So yeah, and then lastly, the Nexplanon. So this is something that's inserted in your arm and is a form of birth control that is going to also be a form of progestin. So etinogesterel is the type of progestin that's in it. And this is something that you go and you get inserted at the doctor's office and you can keep it in. I should have looked up exactly how long you can keep it in. I can actually do that right now. Next one on. It's for a while. Next one on how long lasts. We're just really doing a
This one honestly terrifies the shit out of me.
me too, because like God forbid, so like it's 3 years you can have this in.
Yeah.
When I was looking into it, they were like, "Are you very active?" And I'm like, "Yeah, I train a lot, I do all kinds of things." And they're like, "Well, you could be at risk for it moving in your arm if you're like a very active person." So I wouldn't recommend it for most people that are super active, from what my OB kind of educated me on.
Hmm.
But again, another progesterone form of birth control. It'll inhibit ovulation, thicken the cervical mucus, thin the uterine lining. It's great for people that want long-term birth control because it is good for up to 3 years. Good for people who can't use estrogen, and it's good for breastfeeding mothers as well. So if you're somebody that's recently had a kiddo and you're really nervous about getting pregnant, although getting pregnant while you're breastfeeding is pretty rare, but it can happen. It absolutely can happen. But it can be a good fit for those people. So yeah, as we've been kind of talking, like birth control is very individual. Like some people will have a great experience on the ID, some people have a great experience on the pill, Nexplanon, whatever. So you kind of have to like go into it with this educational background of like which hormones you're putting into your body, talk to your OBGYN about what might be the best fit for you based on your own past medical history, period history, your fertility goals in terms of how long you want to prevent pregnancy for. And kind of come up with an individualized like treatment plan, if you will, with your OB. But we hope that helps because I get so many questions about the different forms of birth control and like what they do and which one should I go on. Yeah.
And it's again depends on every single person. It's such a wide umbrella, and there's so many different kinds and like how they can affect certain people. And it sucks when you're going through that and you're just getting on it and you're trying to find the right one for you. That's why like getting a PCP and like getting an OBGYN like opinion on it is so important because they're seeing like what what needs to be addressed when taking it. Say if you're low estrogen, you want like more estrogen in your body, I guess. If you want that, then you take a certain one. If you don't want, you can't take estrogen, you take certain things. So I think a lot of people, not that they don't do a lot of research, but I think they should do more into it before actually go and be like, okay, I'm just gonna do this because this is what everyone else is doing and this is what I want.
Yes. I feel like a lot of people default straight to the pill, like the Junafil, like the estrogen and the progesterone based pill. That's like the most common
It's
recommended.
because it's the most basic. It's like the low dose, you get these, you get this is what happens, here you go.
Yeah.
And
Uh,
it's a very like starter pack.
it's definitely prescribed like as if it's no big deal too. Like a lot of women don't understand the pros and the cons of birth control. And I want to dive into those because I want everybody here listening to be a more educated consumer when it comes to making these decisions. And like, I'm not anti-birth control. I just told you, like, I'm on an expired IUD right
Yeah.
now. I've been on birth control since I was 15. And I know like we don't want an unwanted pregnancy. Like that is my biggest fear in life is getting pregnant when I don't want to be pregnant.
Mhm.
And now with like the background and education that I have and knowing my body and my own period regularity, I feel comfortable kind of making the decision to come off the pill and like just kind of naturally tracking my cycle, which I love using the Flow app to track my cycle. And there's also ovulation kits that you can use where you can like test to see if you're ovulating. So that can also be helpful. You can also track your basal body temperature. And so if the temperature rises, then that's a good sign that you are likely ovulating. So a few other things you can look to. You can also look at your like your discharge. So like if you have very like thick discharge, that's usually a sign that you are ovulating at that time of the month. So that's another kind of sign of biofeedback. Some women can experience some sort of cramping during ovulation, sometimes even a little bit of spotting. I remember I had a client, like she has PCOS. And so like we finally got her periods regulated and she's great. She's super healthy now. But she was like, oh my gosh, I'm spotting a little bit with my ovulation. Is that normal? And like she had like a moment of like panic that ensued.
Yeah, right.
Oh no, it's okay. And like that's just her norm now that her body's ovulating and she's like in a healthy place. But like you can have some spotting. You can get a little bit more acne around that time because estrogen is highest at that time. You can also hold a little bit more water because estrogen is going to be highest at that time. And anytime estrogen is high, there's going to be some sort of water retention likely present. So yeah, those would be kind of like some natural tracking. And like, I feel like we should dive into the pros and cons of like what the pros are, what the cons are of birth control.
So the most obvious one is unwanted pregnancy. And
Right.
that's that's like mainly if you are having an hormonal imbalance and you are looking for something instead of like getting it through nutrition or getting through supplementation, you want to do something in your primary care is kind of pushing you to that in a way in low doses in a very like in low doses would be good if you're struggling with that and you get these opinions from all these different places. That's one. But the cons are that it acts as a band-aid for these PMS symptoms. So like when I got on it, I was 15 and I was like, I'm getting such bad cramps and I'm throwing up and I can't go to school because my cramps are so bad. Like I'm missing school. I need to get on something where I can kind of suppress those and be able to like get on with my life. But I know I can't be on birth control forever. So I'm literally just pushing the time back. I'm pushing everything back until whenever I get off it, that those are going to come back again.
Mhm. Yeah. And that's the thing that sucks is like a lot of women are in Kate's position. Like they were 15 years old, had painful periods, they went on birth control, not necessarily to prevent unwanted pregnancy, but to manage the severity of their PMS symptoms. And like the thing that sucks is like when you come off, your period is going to revert back, or if not worse, those first couple of months to what you had previous. So the big thing I want to get across on this podcast today is that birth control should not be your treatment plan for painful or uncomfortable or irregular periods because it's not actually solving the issue at hand. if I had to guess, Kate was probably in a pretty estrogen dominant like state. And like, obviously when you're 15, your body's still developing. So you're still kind of regulating, you're still kind of getting your hormones to a normalized place. And where Kate got her first period at what, 14, you said?
I think it was like 13. Might have been 13.
So she went on birth control like 2 years after she got her period for the first time ever. So her body, and mine too. I mean, I got my period a little bit younger than Kate. I was 11. I went on birth control at 15, but like our bodies were still developing. Like you really
Yeah.
shouldn't be on birth control at that young of an age, in my opinion. I like, unless you're going to be having sex and you don't want to have a teen pregnancy, which is definitely a good idea to go on birth control. But it's like a lot of women go on it to resolve their issues. It's just a band-aid. And you're just prolonging the issue, maybe making it worse for when you do come off. So
Exactly. And then when you're going through that age of like middle school to high school and like everything is changing, you're just a teenager, you're gonna feel anxious, you're gonna feel depressed, you're gonna have this wicked bad like hormonal acne, and it's all kind of just exuberating that. It's heightening all of this. And it's just making it worse. And you're just adding to it. But you don't know that in the moment because you're like, "Oh, this is just helping with my cramps. This is what I need." But you don't know that the other side effects is, "Oh, I'm going to be anxious every single day of my life now.
yeah,
And I'm going to get this wicked bad like acne every time I'm around my period." And it just adds to it. You know what I mean?
yeah. And I think too, like when you're a teenager, there's so much discomfort just in life, like because your body's changing so much. Social groups are a lot. There's a lot of peer pressure to fit in. And like, yeah, like if you're struggling with acne and you tell your doctor you have wicked bad cystic acne, and they're like, oh, if you go on birth control, it's gonna fix it. Like, who wouldn't say yes to that? Like,
Exactly.
worst
Especially when you're 16, you're like, "Oh my god, you're gonna fix my acne that I have all over my face? Perfect, let's go on it."
yeah, and that's the most important at that time in your life is to not have the acne, so you're not getting made fun of, and that you can feel confident and you can like, be amongst your peers and feel
Mhm.
normal today. So it is like in many ways, I'm like, oh, I feel like sometimes, and I know like the doctors are probably not doing this on purpose. Like, why would they want to do that? But like, it's almost like preying on like an innocent population that like doesn't really
Yeah.
know much. They're like ready to take what you recommend them, and like you're making these big decisions at a pretty young age.
Yeah, that's like a big decision to have like a 16-year-old agree to.
Absolutely. Yeah, and it's like, of course, guardianship is there, but like a lot of parents don't know what birth control does. Like my mom didn't know. Like she definitely didn't know. God love her, but she had no idea.
Yeah, exactly. So, I think that also goes for a lot of things, like, when I not we can have a whole 'nother podcast about anxiety and all that because 'cause I'm the queen of anxiety, but
The
I think
queen.
that was my mom kind tried to steer me away from medication with that for a long time,
Yeah.
and nothing was really working, so I'm like, "I have to do this. This is what I have to do," and I think that was just installed in me that, like, she took it, my sister took it. I'm like, "Oh, I need to take it because they're taking it and it's helping them." So I think that when I went to my primary care, she was like, "Okay, if you wanna do this, let's start with a low dose of, like, the most common one ever." And I think that in my mind, I'm like, "This isn't working, I'm getting resistant from it," like, all these things, and I kept going up the dose and then changing the medicine and then doing this, and it was a lot of change, especially when did I go on it? I might have went on it when I was 14, and I'm still I haven't in, like, a month or 2, but
Yeah.
it's been a long time with, like, these medications, especially when you're that young and you don't know what's going on with your body and how these things can affect you and how not that the primary care is taking advantage of you, but in a way they are.
Yeah. Yeah, again, it's like a lot of misinformation on the consumer's end. Like they just
Yeah.
don't. And I think in a lot of conventional medicine, like BC is very commonly prescribed for a lot of signs, symptoms, problems, when it's not really the intended fix for it, if that makes sense.
Exactly.
Like it should be for unwanted pregnancy and that's about it. So yeah, I think too, like additionally, like aside from the negative effects that can happen in that regard, there's a lot of nutrient deficiencies that can take place too. And when you're on birth control, your absorption is a little bit wonky and you're going to lose more of your water soluble vitamins like your B vitamins, vitamin C. You're going to lose more vitamin E, zinc, magnesium. All of those things are going to be more water soluble aside from vitamin E. So when you're more depleted in that regard, you're going to have more signs and symptoms of those nutrient deficiencies. So I really like having people who are on birth control or coming off birth control supplement with a prenatal. It kind of keeps you covered because it's a higher dose of everything that your body needs. And when you're in a more depleted state like that, taking a prenatal just helps you to mitigate having to take thousands of like the B complex and then this zinc and
It's
then
got
this.
everything in there. Yeah.
Right? Like it's got everything. So that's something I recently started doing maybe the past 4 months. I've been like, just take a prenatal instead of like this laundry list of like this B complex, this zinc, this and that. I'm like, why not just do that? So that's kind of my recommendation when it comes to like addressing some of these deficiencies. Now, of course, like each prenatal is dosed a little bit differently. I commonly right now, I recommend First Form's prenatal. I actually really like it. I don't just recommend it because like I'm associated with them. Like I recommend regular multivitamins all the time. Like I love First Form, love it. They're great. But like I do really like their prenatal. And they also have probiotics in there, which is nice. So then the person doesn't have to take a probiotic. So it's kind of like a 2-in-1, which is nice. But they have a high dose of everything that you need in there. Um, so another one to kind of consider is like selenium. So like if you are somebody that enjoys eating nuts, eat some nuts. If you can eat Brazil nuts, that'll be even better for you. They're higher in selenium. But having nuts can be great. Making sure you're getting a good variety of fruits and vegetables is going to help you meet a lot of those micronutrient needs. When it comes to B vitamins, you're going to see a lot of those come from your protein sources, like animal-based protein sources, but also things like whole grains. But most of the time, we're probably not going to get enough just from the foods in that situation because of the depletion that happens. So that's why I like to also supplement with the prenatal on top of that. But it doesn't hurt to like go out of your way to try to get those food sources in for sure.
I have a question.
Yeah.
So we were talking about PCOS earlier.
Yeah.
What are your thoughts on birth control and PCOS?
I don't like it. I don't like it. And I actually last year we had a guest speaker from Brigham and Women's come in and she was a PCOS fertility specialist and she did a whole lecture on PCOS and nutrition. And she had the viewpoint of she does use birth control in some of her patients to help with just having the uterus lining shed. Because if that doesn't shed, say you never get a period, say you never get a period, that increases your risk for ovarian cancer. So I understand her recommendation in that regard. But why not, instead of put somebody on birth control, get their hormonal profile in a better spot so their body's doing the thing on its own. Like that's my perspective and like how I like to work. And again, I'm not an OBGYN, I'm a dietitian, but like there are things you can do with food, exercise, nutrition, over-the-counter supplementation that can actually really regulate somebody's period, whether you have PCOS or not. So I don't like it as a recommendation because it acts as a band-aid.
Mm-hmm.
It usually doesn't make the issue better. And a lot of these women that have PCOS, a lot of their poor symptomology is also going to be rooted in poor blood sugar control. So, like, you would be surprised at how much just getting somebody's blood sugar under control helps to improve their period when they have PCOS, because that's such a cornerstone symptom. They basically have type 2 diabetes when you have PCOS. There are 3 different forms of PCOS, though. There's lean PCOS, the standard PCOS, and there's another form of PCOS, and I'm forgetting it off the top of my head. It's been a long time since I read that book. But lean PCOS is one that doesn't always have like the issue of losing weight, the weight loss resistance. They might not have blood sugar issues, but your typical textbook standard case of PCOS, usually there is unwanted weight gain that begins to happen for a lot of women, or they have really intensive periods, and they're like, "What the hell is going on?" And I find that for people that are falling into that standard, like textbook PCOS case, birth control is like one of the worst things you could probably go on, in my opinion. I think you should try to exercise every other option first before going on to something like that. If you have lean PCOS and you're trying to prevent getting pregnant, like you're probably in a safer position to go on birth control. And when I say safer, I mean less symptomatic. So like less of these nasty symptoms that we're talking about. I find that though PCOS is complicated and like every practitioner works with it differently, but I like to try to get the body to do its thing. And I'm very persistent about that. So yeah.
Well, that's good. That's good that you're not immediately going to something that's not even meant for that.
Yeah. Well, and like that's the
Have
thing.
such a band-aid.
And like I feel like everybody with PCOS, they get told birth control, 1200 calorie, low carb diet, boom, go exercise. That's your
Yeah,
treatment.
they're told to like restrict their diet crazy.
And so this lecturer person, she was a very intelligent woman, like she really was. And she knew that at my school, we practice from like a Hayes perspective. So health at every size, like we're really big on that. Not every person that goes through the program like truly believes that. Like we all have different beliefs. I definitely am more of a Hayes dietitian now. I never thought I would be, which is like crazy. Like if you asked me this 5 years ago, I think I said on a podcast, I was like, I don't understand Hayes dietitians. That makes no sense. And now, like after being educated, I'm like, oh no, this makes so much freaking sense. Like what an idiot I was 5 years ago to say that. But she knew who she was speaking with. So like with her lecture about nutrition, she tried really hard to like not say the restrictive parts of things, but like she couldn't help herself. Like she kept
That's just what she believed in. Yeah.
and it's the standard treatment. And like if you haven't been, in Simmons University's program where you're learning how to be a Hayes dietitian, like this is new stuff, guys. Like this is not something like every school even practices. Like some people would say a lot of the Hayes stuff isn't even backed up with research, and there is, and it's very interesting. But she tried, and I give her the kudos for trying. She at least tried. But a lot of these women, they're told to restrict, and they end up with disordered eating. So
Yeah.
believe it or not, like a lot of the people I work with, they have some sort of hormonal issue or some sort of digestive issue, and then they have disordered eating on top of that because all of the treatment plans told them to restrict their food, avoid this food, you can't have this food because it's high FODMAP, you got to be on a low FODMAP diet, like all these things. And it's like you're creating a whole nother host of health issues by creating the disordered eating. So it's like you don't have to be super low carb in order to manage PCOS. I've seen it. I've seen a girl on 300 grams of carbs with PCOS and she lost weight. Not that it's about losing weight, but it's like it doesn't need to be super low carb.
Yeah.
I think for a lot of people with PCOS, they need to focus more on like stress management. Like that's huge because their body's already in this inflamed state. And it's like an autoimmune condition, basically. So you have to kind of treat it that way. So a lot of women are over exercising. They're restricting their food. You actually need to find the perfect balance. That's kind of all this is like finding the perfect balance and allowing for progesterone to upregulate enough that you can like do the thing. You can ovulate, you can have a regular period, because that's going to help you in turn with like body recomposition goals, etc.
Exactly.
So yeah.
And another thing to add, like it's gonna take time. It doesn't happen overnight. Nothing.
No, absolutely. Like I have my client, shout out Nicolette. I know she listens to this. Like Nicolette had PCOS and like we didn't even know if it was PCOS, like a true PCOS diagnosis for a while until her lab work kept coming back high test, like textbook PCOS. Like, and we had it for like 3 different labs.
Yeah.
And I was like, no, you have PCOS, but you can manage it. And like we've gotten it to a point where she has regular periods. They're not painful at all. Yes, we are using things like Vitex Chaseberry, and we're going to talk more about certain supplements that I recommend when coming off birth control. We are using inositol, which I love for PCOS. We're using some players to help us kind of regulate her hormone health, but she has PCOS. She's going to live with this forever. So like she needs some sort of management, but she's not on birth control. She's losing weight without going to extremes. She's eating like intuitively at least like once or twice a week, and she'll go back to eating intuitively. And like we did a whole stint about intuitive eating at one point, but she definitely is a good case to showcase. Like it took a year. Like her year subscription just went through like last week. So like we've been working together a year. It took that long, but like we got there, and she's in a much better place. She's been good for like maybe 5 months now, but like yeah, take some time. Oh, I love PCOS. We should do a whole podcast on PCOS. Like I could just unpack forever. I love talking about PCOS.
I love that.
Amazing. Cool. Okay. Live, laugh, love. Let's see. I think we kind of touched base on that. Oh yeah. So like in terms of like the anti-inflammatory foods and like specific foods, Kate, what do you think is like a good fit for somebody like coming off birth control?
So like anti-inflammatory foods like fruits, vegetables, nuts, like selenium, what you said, like the Brazil nuts, that's gonna be really good. Foods that contain DIM.
Yes.
So DIM is dindolimethane.
I know. I did a paper on this. Dindomethyl.
Dindolimethane.
We try to say the crazy names on this
Yeah,
podcast.
that's
Give
what
us,
we're gonna call it. It's dim,
it's
but
dim.
it's found in, like, broccoli, green leafy vegetables, all these things, and it has that dim in it for hormonal balance. So it's gonna block the testosterone in it, and then increasing beneficial estrogen in it. So this can help a lot with PMS symptoms.
Yeah. What's really cool about DIM is it's in the broccoli and then it hits your stomach acid. And when it hits the stomach acid, there's a conversion that happens to indole 3 carbinol. And, or no, it's indole 3 carbinol and then it goes to DIM. That's the conversion. That's how it
Mhm.
works. And the stomach acid is what like makes it do the thing. And I remember learning that and I thought that was so freaking cool. I
Like a
just want
science experiment when you like pour two things into together and it like changes color.
Yeah. And so I remember being like, wow, that's really cool. And yeah, so like that's kind of how it works. You have to like consume it in order for it to like do the thing.
Yeah,
But for those like looking for supplements with DIM, some may say indole 3 carbinol versus DIM is the same thing.
exactly. Because it's gonna do the same thing, but you know
Yeah.
what I mean. But other than that, like monounsaturated fats, polyunsaturated fats, so olive oils, avocados, those things, omega 3s. So you got salmon, you have walnuts, flax, chia seeds, all these things.
Mhm.
So that's some supplementation you can take with food that are going to help those symptoms.
Yeah, and I'll add one last thing here too. With omega 3s, most people aren't getting enough from their diet. Even if you're consuming a lot of plant-based omega 3s, that's going to be in the form of ALA, which isn't as bioavailable as EPA and DHA, which comes from like the animal omega 3s. So like your fish, the algae oil does contain EPA and DHA. So great for vegans or people that don't want to have fish oil. But most people need a fish oil supplement, some sort of supplement to meet the amount of omega 3s that you need. Our food system is so much more abundant in omega 6s, and that's why they get a better reputation. But you need omega 6s. They're actually not bad for you when you have the right amount and you have a nice balance of omega 3s.
Yeah.
But the issue is our food system doesn't have a ton of omega 3s. So you have to kind of go out of your way to get them. So even myself, like, and I get a lot of plant-based omega 3s in. Um, and I go buy the bougie eggs, like try to get the omega 3s in through there. Like I still supplement with fish oil. So that's one little recommendation, especially if you're coming off BC.
Mhm.
The thyroid. So like your thyroid is the master gland of the body, basically. And it's going to be in charge of your metabolism and it's highly, highly interconnected with your reproductive system, your adrenals, etc. So a lot of women, they can actually experience hypothyroid-like symptoms when on birth control because the ovaries are basically suppressed. So that, bodily system is a little bit out of whack. And when one system is out of whack, it can then begin to impact things like your thyroid. And the reason I point to here is because your thyroid's here. It's like a little butterfly gland in your throat. And when it comes to supporting the thyroid when coming off birth control, I like to see labs before I make any recommendation for like thyroid boost by New Ethics. But sometimes I bring in thyroid support. So I'll bring in thyroid support right away just to be super proactive, especially if somebody's had a lot of hypothyroid like symptoms. So, like things to look out for, like really slow digestion, which can also be related to estrogen dominance. So it's like sometimes you're like, what is it causing the problem? Sometimes it's both. Sometimes it's more than one, but that's why labs are great if you can. But sometimes I bring in the thyroid support. So like the selenium, as we've been talking, Brazil nuts can be great. Iodized salt. So I know everybody likes the pink Himalayan salt because it's trendy and cute, but like it doesn't contain iodine. So get iodized salt. You can get the Morton's, the Morton's one. Not as cute of a
The one
package.
with the little like the girl with the
Yes, like the girl, like I don't even
umbrella.
know. Yeah, like I think the umbrella. I think you're right. Yeah. So like get her, get the girl with
Good
the
for her.
and like you're gonna be good because iodine is literally like how your thyroid makes thyroid hormone. So you need
Yeah.
iodine. If you have a lot of seafood, you're probably getting plenty of iodine. But for those that don't love seafood, get iodized salt and just like sprinkle that on your stuff. Um, I also love carb cycling to support the thyroid. This can also be beneficial for just blood sugar management. It can be beneficial for appetite regulation. It can be beneficial for digestive health. So like for some people, they need to eat a lot of food. And I have some people that are like metabolic machines, and I want to push food really, really high on some of their training days or whatever it may be. Giving them not like a low carb day, but like a more moderate carb day can be nice psychologically if you're somebody that really needs to push food. But in the case of thyroid, I love doing like a 4-3 split. So like 4 moderate carb days, 3 high days in a row. Or I do like a 5-2 split where I do 5 moderate carb days, 2 high days in a row. And
Mhm.
that's really, really effective. I use that for all of my hypothyroid people. Yeah, I love carb cycling for that. So something to consider. But again, you probably won't know if you have thyroid issues unless your biofeedback is super, super duper wonky, or you get lab work done. And I typically don't have people get labs done until we're like 8 to 10, 12 weeks post birth control because I know and can assume like where they're
Gonna
at.
be all one. Yeah.
And I'm like, it's a waste of your money. Like it just is. But if you want to get labs and you have the funds, go right ahead. But like, yeah, you're gonna be messed up. So I'd wait a little bit. But
We already know these labs are just gonna be all over the place. So it's best if you wait. Wait until at least a little calm down and everything's kind of getting back to a homeostatic place where you can get these get these labs and see like, okay, so this hasn't gone down or this hasn't gone up, and all these things.
absolutely. Yeah. Um, One last thing I wanted to say before we kind of wrap up and talk about the post birth control, like supplementation protocol, is pregnancy while on birth control. So scary yet fun story. So my best friend Carrie, she got pregnant while on birth control. She was on the pill. And yes, there were probably some inconsistencies in taking the pill, which is why if you can't remember to take your pill, you should probably just get an IUD or some other form of BC. But she ended up getting pregnant and now she's had 2 kids now. So that was a little surprise. And I like to share that story because a lot of women, when they're like, well, I don't want to go on birth control because I'm afraid of all the negative side effects. And it's like, well, you could get pregnant technically on birth control, and you can absolutely get pregnant off birth control. So if you want to prevent unwanted pregnancy, come up with a plan. Just come up with a real plan, because you can absolutely get pregnant on birth control. But again, that was the pill. It wasn't like an IUD or something of that nature. So I always like to kind of scare my clients in that way. I'm like, well,
These-
think about it.
I'll
Think about it.
just think about it.
But we love it. And Aubrey's amazing. She's like, oh my gosh, she's
Such
4
a
now.
cute little girl.
Yeah, she's amazing. Dude, she's getting sold. But
You
yeah,
know, keep seeing pictures of her. I'm like,
cutie pie. I know. Oh, it's crazy. So, anyways, post-birth control protocol. So, like, number one, you want to make sure that you have enough energy availability. So you want to be eating enough foods.
mhm.
We also want to make sure we're getting in enough fats. Kate, tell them why fats are important.
So it's gonna help with hormonal health, and it's also gonna help with cholesterol.
Yes. The
Which
cholesterol synthesis is a really important part to you creating hormones. And the way that we do that, yes, our body, has the ability to generate cholesterol and things of that nature on its own. But if you don't have enough fats, you're going to be in a deficient state. And that is going to make it harder for your body to upregulate its own hormonal production. So healthy fats are huge. I don't want to say like fear fats, like during like my bodybuilding days and like my fitness days.
I think it's a big
Yeah.
fear for a lot of people. Like they
It
think
is. And I will say this, like since I've been eating intuitively for the past, I don't even know how many months now, a while now. I think I'm probably close to like 80 grams of fat a day, which like for perspective for people, like that's a pretty high fat diet, but like I'm getting it through things like olive oil, avocados, avocado oil, flaxseed, almond milk, things, egg yolks, like things that I would consider to be like heart healthy fats or healthy fats. And I have seen no negative impact on my overall how I feel, my digestion, anything like that. And my periods, the reason I even bring it up, my periods have been the least problematic they've ever been. And I think there is something to that. Yes, stress is lower. I'm sure that's helping a little bit. But is it really lower? No, it's just a different kind of stress. Now,
exactly.
but it's like, I think there is something to that. Having enough fats can be really helpful. So from like the nutrient perspective, like we talked about, prenatal vitamin can be really great, making sure you're replenishing those water soluble vitamins and minerals. Also, when you start menstruating again, you're going to want to be more concerned about iron. So, in the prenatal that like I recommend, it has the daily RDA of iron needs in there, but also focusing in on iron-rich food sources. If you can do red meat and you like red meat, I would recommend that a couple of times a week, especially around cycle time can be really nice. Uh, Funny enough, I noticed for myself, like I crave more red meat around cycle time. Like
Oh
I'm
yeah.
missing.
Or you're like craving the iron. You're like you need
Yeah.
red
It's
meat. Yeah.
weird. It's so weird. It's like your body knows. So if you can
Yeah.
go with that, that's great. You can definitely go with like plant-based sources of iron found in like whole grains and some of your leafy greens. But you know, that's just something to consider as far as things go when it comes to food sources, aside from like all the supplementation that we're going to talk about. So when it comes to supplements, sometimes depending on the person, I will wait a month before bringing in some of these players. Other times I will do it right from the jump. So I bring in the prenatal even before they come off birth control. I love using chaseberry, which helps to promote healthy ovulation. And I find that it's a pretty safe supplement for most people. However, I had a girl, first time in my career. She was on it for a week. She had one of the most intensive period experiences we have ever seen from somebody. She was like vomiting. She felt dizzy. She felt such intense cramps. She was on it a week, 1 week. I've never seen this. Took her off immediately. Obviously, I felt terrible. Sorry, Mackenzie. I'm sorry that you were the one person that had a negative experience with it. I reached out to Justin. I'm like, have you ever seen this? Like, this is insane. He's like, oh, yeah, sometimes. I was like, she's only on it for 7 days. Like, insane.
Yeah. How does that
So
even like take effect that fast? Like,
that's it. I'm like, how did it even like do anything? And she has like really short periods. Like she gets her period like every 20 something days. So I was like, all right, well, time to
oh,
like fix this. And yeah, so she was one situation that I wanted to bring up because it's like, yes, this is usually a very safe supplement, but there can be negative sides, you know, depending on the person. So just heads up if you're going to be utilizing any of this on your own. I just like to put that disclaimer.
mhm.
I do think if you're gonna do something like this and you really don't know what you're doing, like not to be like rude, but like get a coach, even if it's just for like 3 months. Get a coach, have them guide you through it. It'll make it easier on your end.
It's gonna make that process so much like better, and like you don't have to figure out what to be put in your body. You can have some like almost like have someone just tell you what to do, and you're like, okay, sure, yeah, that sounds good because they're educated. They know what they're doing. Like they've experienced this.
Like, what if you take the chaseberry and you have the same experience Mackenzie did, and you're like, oh, I don't know what this is from, and then you like keep taking it and it's not a good fit. So like, just like my disclaimer, like most cases, I'm like, you probably coach yourself, but like if you're doing something like this and you really don't have a background in nutrition, physiology, hire somebody that does because it
Yeah.
makes it easy. I love Jumpstart by New Ethics, and this has maca root in it too. So, like for a lot of people when they're coming off birth control, depending on which form of birth control, not only is their progesterone low, but the estrogen can also be low. Maybe estrogen is higher than progesterone at that time, like in that tango, if you will. But usually they're both suppressed when you're coming off. So I like Jumpstart for some cases. I'll bring in Bezwecken, which is basically a bioidentical form of progesterone if needed. But that's usually like my last resort, if you will. Like I really only use that if I need to, because it's a pretty strong, it's like, yeah, it's like supplementing with progesterone, but I like to try to use the chaseberry first. That's like my go-to. I love chaseberry. I'm a big chaseberry girl.
Mhm.
And usually that's all we really need. Lower intensity training. So like you can't be training to failure when you're coming off birth control because that's going to place a greater demand on the central nervous system. And that's going to be very taxing. It's going to be very hard for your body to do the thing, to upregulate that hormone production because it's going to be producing more cortisol. So, funny enough, little lesson here. When you're really stressed out, there is a conversion that basically takes place of your progesterone to cortisol. And when you're putting your body into a very stressful environment, it is driving progesterone down, driving cortisol up. So you don't want to be training very hard when you come off birth control. I
Mhm.
like to see somebody get 2 to 3 regular menstrual cycles before I even start toying around with training to failure. I will also say this, like, I don't think a lot of people actually train to failure, so it's maybe not as big of a deal for some people, but like for my people I know that train really hard, I'm like, I really need to pull them back. Um, I also like doing light intensity, steady state cardio in these situations if I'm using cardio. Sometimes I pull cardio out completely. Just depends on the person and like what their body needs. But I don't know, the goal of this is to decrease the stress, decrease cortisol production as much as possible. Make sure you're getting enough sleep. I can't say this enough. If you aren't getting enough sleep, don't even bother getting the pills. Don't even bother getting the supplements. Don't bother. Save your money because the sleep component is so huge. And I have people where like they have really busy lives. And it's either they train or they sleep. And I'm like, you're sleeping. You're pulling down training. I will pull your training down to twice a week if I need to. I will
Yeah.
pull your training down to once a week if I have to. Whatever we need to do to get sleep is more important during this time. So those are kind of like some takeaways that you can kind of look into and explore as far as like supplementation goes. But everybody's different and they need an individualized approach. So if you don't know what you're doing, hire somebody that does. So yeah, that's my spiel. Cool. Amazing. Okay. I feel like that's it. I feel like we touched base on like everything.
No, I think we did a very good job with touching base.
Deep dive. All right.
Explaining all of these birth controls, how they affect people, what we can do to fix it.
Absolutely. Cool. All righty. Fantastic. We'll see you guys in the next one.